Another thing, now this is difficult for lots of people to talk about, but it's, I wish to God I had known this, and so I'm just going to tell you frankly about it, that it's really, colorectal cancer treatments can have a big impact on your sexual health and on your intimate relationships. And in that, through a variety of pathways, there's, of course, things relating to body image, self-esteem, fatigue, pain, anxiety, all these things, of course, impact us as sexual beings. But quite mechanically, if you are a woman and you are undergoing radiation, external or internal, to your pelvis, you are going to need to get direction and guidance on how to sort of preserve your vaginal tissues. And one way of doing that is through these things called vaginal dilators. And what is a vaginal dilator? I'd never heard of it. I had all kinds of strange images of strange machines. But what it is, it's essentially an upside down plastic test tube. And they tell you to use it. The important thing to know, though, there's a window of opportunity to use it. If you don't use it within that window of opportunity, you may actually lose. Your vagina may close to a point where it's so small that sexual function is impossible, or conceivably even medical exams become impossible. So I think that all women, gay or straight or married or in relationships, whatever they are, deserve the opportunity to preserve their sexual function for the rest of their lives. And the way to do it is to use these vaginal dilators and to use them at the right time. Now, your healthcare team can help you figure out the timing, but essentially, sometime after a couple weeks after your radiation is over, you have to start this treatment, or you'll face consequences. And I remember listening to a Colon Cancer Alliance seminar some years ago with an expert who was describing this, the sexual damage that colorectal cancer treatments do to people. And a woman phoned up who sounded from her voice like a woman in her 60s, and she said to the doctor, "I'm left this way, all damaged. Was there something I could have done to prevent it?" And he said, "I'm sorry to tell you this, but there was a way. There would have been a way. There was these vaginal dilators." And the woman burst into tears, and she sobbed right there in the middle of this webinar. So doctors are all focused on, you're going to die if we don't treat you. This matters to us. You have cancer. We have to save your life. They're not thinking very often about things that might be important to you, like your sexual well-being. So it's really important to get a jump on the kinds of things that that can harm you. And for men, rectal cancer treatments, radiation treatments can impact sexual function as well, but that doesn't have to be either. There's Viagra, there's other treatments that can really help men optimize their functioning. Many men go through the first year treatment just fine, and they think, oh great, I escaped. It's the second year that impacts them. Radiation continues to affect us for many, many years after our treatments. And for many men, that's upsetting, it's shocking, it's all the things you can imagine. But there's no need of it. Because there are treatments out there that can help, but it does mean that you are going to have to raise that with your healthcare providers, as tough as that can be. So there you are.
For an interactive tool to learn more about your colon cancer and your personalized treatment options, go to mycoloncancercoach.org.